This is Barry Zalma on insurance. Today, a recent 11th Circuit Court of Appeal explained how a doctor defrauded Medicare and Medicaid and is instructed to go to jail, directly to jail, do not pass go, and pay back the government for everything you took fraudulently. This was a doctor who treated Georgia patients for more than 70 hours in a day while he was gambling in Las Vegas. In United States of America versus Douglas Moss, the United States Court of Appeal for the 11th Circuit on April 12, 2022, affirmed the conviction, sentence, restitution, and forfeiture orders of millions of dollars taken in Dr. Moss's crime. Explaining its decision, the 11th Circuit explained that Medicare and Medicaid combined spend $1.5 trillion a year, which is more than 1/3 of the total health expenditures in the country. Like other government health care programs, these two work on the honor system, trust and more trust. Both programs take a pay first, ask questions later, if ever, approach, which leads to crime and more crime, both sooner and later, because the government forgot what President Reagan taught, which is trust, but verify. A trust-based system is only as good as the people who are trusted. Douglas Moss is one of those who was trusted, but not trustworthy. As a physician, he fraudulently billed Medicare and Medicaid for millions of dollars for visits to nursing home patients that he never made. For his fraudulent conduct, Moss was convicted of conspiracy and substantive health care fraud, sentenced to 97 months imprisonment, ordered to pay restitution of about $2.2 million, and ordered to forfeit around $2.5 million. He, of course, appealed, using the funds he stole to pay lawyers to challenge the conviction, sentence, restitution amount, and forfeiture amount, which is nearly every component of the judgment against him. To explain Moss's crimes, the 11th Circuit began its analysis with how Medicare and Medicaid determine how much health care providers will be paid. It explained that Medicare and Medicaid are federally funded health care programs. Medicare pays claims, which are requests by health care providers to be reimbursed or paid for services provided to Medicare recipients. It also contains a code for the procedure or service provided. The CPT codes, which stands for Current Procedural Terminology Codes, are a national uniform coding structure created for use in billing and overseen by the American Medical Association. The CPT codes are used by all health insurance companies and by Medicare and Medicaid. A code represents at least two things: the procedure or service performed, and the level of complexity involved in it. One type of procedure or service can have more than one CPT code because the same procedure may, in some cases, be more complex than in others. Generally, for any given category of procedure, the more complex the performance, the higher the number used for its code. In turn, a higher CPT code generally gets a higher reimbursement amount from Medicare. Most of the fraud in Dr. Moss's case involved claims for visits to nursing homes. For Medicare to pay a claim, several requirements must be met. The service must be provided to a real patient who is properly enrolled as a Medicare beneficiary. It must be provided by a health care provider properly licensed and enrolled as a Medicare provider. It must be a service covered by Medicare, and it must be properly documented and billed. The service also must be reasonable and medically necessary. Healthcare providers sign a certification statement agreeing they will comply with all of those requirements and will not submit false claims. To properly bill Medicare at the physician's rate for services provided in a nursing home setting, the physician must be the one in the patient's room, directly providing the service to the patient. When an assistant performs the service, the claim submitted to Medicare must disclose that fact. Well, Moss didn't want to comply totally and created a fraudulent scheme to obtain more money from Medicare than Medicare really wanted to pay. Moss was the medical director and attending physician at 4 nursing homes. He recruited Sean Taiwan to be his physician's assistant, and as it turned out, his co-conspirator. Moss had Taiwan help with the nursing home patients, and he trained Taiwan how to conduct visits with those patients. Between January of 2012 and January of 2015, Moss billed 31,714 claims to Medicare for nursing home visits, 477 of which were quoted as 99306, the highest code for initial nursing home facility care that required him to spend at least 45 minutes with the patient, and 25,468 were quoted as 99309 and 5,769 as 99310, which are the 2 highest codes for subsequent nursing facility care. Those numbers suggest a staggering amount of work, a seemingly impossible amount of it. And as it turned out, the amount of work billed was impossible. The claims Moss submitted would have required him to see more than 50 patients a day for 293 of the days in the 3-year conspiracy period, and even more than 100 patients a day on some days, and more than 150 a day on other days. Not only that, but based on how long the CPT manual suggested those visits should take, Moss was sometimes billing Medicare for services that added up to more than 24 hours a day. He did that on 275 days, and on some days he billed for services that would have taken him more than 70 hours on that day. The services Moss billed on one stellar day would have required him to put in 100 hours in that one 24-hour period. Moss alone miraculously stretched some of his days to far more than 24 hours. If truthful, Moss proved Einstein wrong and was able to stop the running of time and work harder than humanly possible and squeeze into a 24-hour day 70 to 100 hours of work. Of course, Moss's miracle was non-miraculous. It was just old-fashioned fraud. Moss's billing revealed he personally had seen 345 Medicare patients and 193 Medicaid patients in Georgia. Those two sets of claims are outstanding in the field of Moss's fraudulent claims because instead of being in Georgia treating patients on those days, as he claimed, Moss had been in Las Vegas gambling. In addition to submitting claims that were fraudulent because he had not performed the services that he had billed in his name and at his rate, he submitted claims that were fraudulent in another way. He also submitted claims that were fraudulent because whoever he claimed had performed them, they were for services that were medically unnecessary or did not involve the level of complexity indicated by the CPT codes that Moss put on those claims. Taiwan, the medical assistant, testified that probably for 95% of the time or more, when he himself had visited a patient, there was nothing to do. Instead, what he would do is walk into the patient's room, ask if everything was okay, and because a majority of the time the patient said he didn't need anything, Taiwan would then leave. He usually did not do a physical examination, take blood pressure, or check the patient's pulse. As Taiwan stipulated in his plea agreement, he would just lay eyes on the patient, spending only 3 to 5 minutes with them during visits, except for in the uncommon event that they had some actual medical need. According to him, there was no medical purpose for most of the visits, and he did not think he had any reason to be making them. Moss had him make the visit anyway, and bill it at the highest code solely because Moss wanted to increase his payments from Medicare, which he did. In that way, Moss added another layer of fraud on top of billing in his name instead of Taiwan's name. He also billed for any services that were provided as if they were far more complex and time-consuming than they actually were. Moss, after his arrest, eventually went to trial, and after a 7-day trial, a jury found him guilty on all counts. Moss's pre-sentence investigation report recommended a guideline range of 78 to 97 months. That range was based primarily on a loss of $6,701,163, which was the amount Moss had billed to Medicare and Medicaid. That factor alone caused an 18-level increase in the offense level. The court sentenced Moss to 97 months imprisonment, the top of the guidelines range. It also ordered him to forfeit $2,507,623.69, and in addition to pay $2,256,861.32 in restitution to the government. The aggregate dollar amount of fraudulent bills submitted to the government health care program shall, when considering conviction issues and sentencing, constitute prima facie evidence of the amount of the intended loss. That is evidence sufficient to establish the amount of the intended loss if not rebutted. Moss intentionally billed in a way that would maximize the money he received from Medicare. As the district court put it, while Moss may not have expected that Medicare would reimburse him at a rate of 100%, it is apparent that he manipulated his billings to maximize his profits. The way Moss maximized his profits was by always billing his claims at a rate higher than the one in Medicare's schedules. By billing more than the scheduled amount, Moss ensured that he always got the full amount Medicare would pay. To no one's surprise, Moss contended that the $2,256,861.32 in restitution that the court ordered him to pay was too much. a reading of the Mandatory Victims Restitution Act, 18 U.S.C. Section 3663A, paren C, close paren, a defendant convicted of fraud must pay restitution to victims of the offense. Restitution must be based on the amount of loss actually caused by the defendant's conduct and reduced by the value of legitimate medical services provided. When services are not medically necessary, Medicare reimburses at a rate of $0. Because Moss's estimates failed to embrace, salute, or even nod at medical necessity, the district court did not clearly err in giving it little or no value, and the 11th Circuit therefore upheld the decision of the district court with regard to restitution. Given Moss's failure to identify a single properly billed claim, he did not persuade the 11th Circuit that the district court clearly erred. In my opinion, the 11th Circuit admitted that because Medicare and Medicaid payments are made on the honor system, it is wide open to fraud perpetrated by healthcare providers with no honor. Moss was obviously a provider with no honor. That the scheme succeeded for 3 years is because the system believes all of the healthcare providers are honorable and just paid Moss what he asked, even when a simple calculation would have shown that he was billing for 70 hours of services in a single day. Moss made a great deal of dishonest money only to complain he was not allowed to keep the fruits of his crime, and as a kind and professional doctor was now required to practice medicine in the Federal Gray Bar Hotel, the federal prison. Hopefully his conviction and the fact that the 11th Circuit affirmed the conviction, the restitution order, and the order requiring him to forfeit more than $2.5 million will deter other healthcare providers from attempting a similar fraud. I doubt it, but it's something to be hopeful about until the courts and the Justice Department convict more healthcare providers and send them off to jail. This video was adapted from my blog, Zelma on Insurance, which is available at zelma.com/blog. This is also information that can be used if you view my 10-volume treatise, Zelma on Insurance Claims, which is now in its 3rd edition and is available as both Kindle books, paperbacks from Amazon.com. Thank you for your attention.